So these are the special tests. First, we're going to start with the Cosen's test. So extend your elbow and make your palm into a fist and extend your wrist. And good. And it's positive if there's pain or weakness, and it indicates either lateral or medial epicondylitis. So this is now the valgus stress test, and I'm going to stabilize your elbow, push your forearm outwards, and relax your arm. And if there's pain, it's positive if there's pain or laxity, and it indicates either a UCL or an MCL sprain. So now the varus stress test. So I'm going to stabilize your elbow and push your forearm inward. Okay. And if it's positive again, if there's pain or laxity, and it indicates RCL or LCL sprain. So now this is the finger dip, hip, and IP joint stress test. So I'm going to stabilize above your joint, moving the fingers gently. And if it's positive, if there's pain or extra movement, and then it indicates a ligament sprain. So this is the wrist ligament stress test. So I'm going to hold your forearm and just move your wrist in different directions. So if it's positive, if there's pain or laxity, and it indicates ligament wrist sprain. So now this is the MCP joint stress test. So I'm going to hold the metacarpal and put stress on the MCP joint. And if it's positive, there's pain or laxity, and it indicates a collateral ligament sprain. So now the squeeze test. So I'm going to squeeze the radius and ulna together, and you tell me if you feel radiating pain, and it's positive if there's radiating pain, and it indicates either a fracture or a syndesmosis injury. So I don't have a tuning fork here, but for the tuning fork test, you basically take the tuning fork, you activate it, and then you place it on wherever the bone is, where it's feeling pain. And if it causes sharp or radiating pain, then it's positive if there's bone pain, and it indicates a possible fracture. So the Finkelstein test, so make a fist and tuck your thumb inside, and now keep your fist tight. And I'm going to bend your wrist towards your pinky. And if there's sharp pain along like the radius side, it indicates tenosynovitis. So for the Allen's test, I'm going to press on both of your arteries at the wrist and open and close your hand 5 times. Now relax your hand. I'm going to release one. And then you're looking for a discoloring, and it indicates poor radial or ulnar blood flow. So now the pinch grip test, it's pretty simple. So you basically just take your index finger and your thumb and pinch together. And pinch together. And if they try to pinch and it's like they can't make the round O shape, then that indicates an anterior interosseous nerve entrapment. So keep your wrist relaxed. This is the lunotriquetral test. Basically, I'm on the lunate and the triquetrum, and I'm trying to move them back and forth. And if there's excessive movement or any type of pain, that indicates lunotriquetral ligament instability or a possible lunate displacement. And that's it for the special test.